am Catherine Joyce Ruiz, a student nurse of Adventist University of the Philippines, and today I'll be performing a return demonstration of the head and neck assessment. Okay, good morning, sir. I am Catherine Joyce Ruiz, your student nurse. I'm going to perform a head and neck assessment. Is that okay with you? Okay, so I'm going first to verify your identity, just to make sure that you are my right patient. Can you state your name, sir? Okay, your age?
50.
Okay, so let me see in your identification. Okay, so I see that you are my patient. Okay, so as what I have said, I'm going to perform a head and neck assessment. This includes your eyes, your ears, and your neck, your throat, and the lymph nodes in your head. Okay, so in this procedure, I also ensure that I perform a proper hand hygiene to prevent transmission of the infectious diseases and bacteria. And also in this procedure, I'm going to use the pen light, the Rosenbaum chart, and the 2 index card measured 3 by 5 inches, and a paper and a working pen. Okay, I also close the curtain and the door to provide you privacy, and I assure you, sir, that all the findings that will be gathered in this procedure will be kept confidential. It will remain between you and me and the healthcare facilitators as needed. Okay, so before we start, sir, let me ask you first a few questions regarding to your past history. Okay, do you have any difficulties in your vision lately? Any blurriness, dizziness? Okay, so that's good. Do you experience any difficulty or in hearing? How about in swallowing? If the food and the drinks? Okay, so you do not have any sore throat. So for the reason of me gathering the health history is to know what I should expect during this test. Okay, so let us first start with the visual acuity, sir. Okay, so as I have said, I have here the Rosenbaum chart vision. So you have to hold this using your hand and stretch it forward. I'm going to move in your side. So, and you have to hold this index card and cover one of your eye, while the other, that is the eye we're going to test. Okay, you have to state the number that you see. Okay, well, now we're testing your right eye. Please state the number.
9858742583745639259874258987426.
Okay, so now how about the other eye? Okay, again, state it.
985284846388745639255
Okay, good.
428365
Okay, good.
374258 9874226.
Okay, so very good. So I am noting that you have a 20/20 vision on both of your eyes. No squinting and repositioning of the head have been observed. Okay, now we're going to proceed to test your visual field. Okay, you're going to use again that index card. So in your visual field, we're going to perform a static finger test. Okay, can you hold your index finger in your left eye? Okay. So I'm going to show you a number using my hands, my fingers as well. And you have to state what number you see. But you have to stare at me and don't look at my finger, okay? Okay, so first, what number?
1, 2, 3. Hindi naman kita.
Okay.
1,
Again. Okay, again. Let's repeat it. about the other eye?
1, 1, 2, 2.
Okay, so very good. Now I am noting that all 4 quadrants are intact for both of your right and left eye. Okay, very good. So now I'm going to test, sir. Your conjunctiva and your sclera. I'm going to inspect the color, the vascular pattern, and if there are any present nodules or swelling. Can you move forward, sir? Going to check your... Okay, so your bulbar is clear and shiny, and your palpebral is okay, nice. Okay, now I'm noting that your bulbar is clear and shiny. Your palpebral is pinkish and red and moist. Okay, so now let's move on to the cornea, lens, and pupil. I'm going to use this pen light and position this oblique in your eyes. You will not stare at this. You will have to stare at me, please. Okay. So now I'm going to inspect for the shadow in your iris and inspect for the pupil size and shape. Okay. So now, can you start me, sir? Open your eyes. Now for your right. Okay, the other one. Okay, so okay, upon observation, I'm noting that your cornea is transparent, smooth, and moist. Okay, your iris is uniform in color, which is brown. Okay, brown color. Your pupils are round and equal. So now let's move on to your extraocular muscles. Okay, so in this procedure, I'm going to use the index card. I'm going to use the cover test. Okay, can you move again forward? Open your eyes wide. I'm going to cover this. You have to stare at me. Open your eyes wide. Then, okay, now on the other eye. Okay, so that's good. So I see no unusual movement of the eye. Okay, now for the 6 cardinal direction, you just have to follow this. Going to draw a huge H shape. You just have to follow it, okay? Again. Okay, so very good. I am noting that your eyes conjugate on the 6 directions. Okay, now for the corneal reflection, I'm going to spot this in the middle of, in between your eye. Just have to, okay, start my face. Okay, so I am noting that the light reflections are in the same spot in your cornea. Okay, same spot, which is normal. And now for the convergence of your eye, again, you have to follow this. I'm going to move it towards your eye and away. And now, I'm moving it towards your eye and now away from your eye again. Okay, that's good. So your eyes are convergent and pupils accommodate equally. I'm noting it now. Okay, so now I'm going, sir, to proceed to your hearing. So I'm going to test your auditory acuity, which is perform the whisper test. Going to cover your right ear and whisper a word, and you just have to repeat it. Okay? Again. yeah, you have to say it louder.
Bed. Lollipop.
Okay, and your right ear, and covering your left ear. Repeat again what you heard.
Lababo. Mask.
Okay, so I am noting that you are able to hear and repeat the whispered words. I'm just going to. Okay. Now I'm going to palpate the lymph nodes to check for any present lymph nodes, the size, the shape, the delimitation, mobility, consistency, and tenderness. Okay. Now I am touching the preauricular, posterior auricular, the occipital, the superficial cervical, the deep cervical chain, the posterior cervical, the supraclavicular. Can you remove your mask? Okay, the tonsillar, your submandibular, and your submental. Okay, so during the process, I palpate no nodes. Okay, so now let's proceed to inspect your trachea for any deviation from the midline. Okay, can you wear again your mask? Okay, face upward. Now I am looking at your trachea. It is aligned properly, no deviation, and it is in the midline. Okay, now I am noting findings. Now for the thyroid gland, I'm going to give you a water. You have to take some, but don't swallow it yet until I command it. Okay. So here's the water. Okay, you remove your mask. You don't swallow it yet. Okay. Take a sip. Don't swallow it yet. Okay. Now, forward. Okay. Now, swallow. Okay. So very good. Okay, so I didn't felt any nodules, so it means there's no tenderness. Okay, so just to verify the documentations and findings, your visual acuity is 20/20 in vision in both eyes, no squinting or positioning of the head observed, and all for the visual fields, all four quadrants are intact for both right and left eyes. For conjunctiva and sclera, your bulbar is clear and shiny. Your palpebral is pinkish and moist. For your cornea, lens and pupils, your cornea is transparent. Okay, it is smooth and moist. Your iris is uniform in color, which is brown. Pupils are round and equal. And for the extraocular muscles, no unusual movement of the eye. Eyes conjugate on the 6 directions. Light reflects in the same spot of the cornea. And your eyes convergence and pupils accommodate equally. And you are able to hear and repeat the whispered words. No lymph nodes are felt. Trachea is at the midline and no deviation found. And no nodules and tenderness felt in your thyroid gland. So that's all. So I'm going to present this to our specialist. I'm going to present this to the specialist, and thank you for your participation. I'm going to go back to you once I get the findings and results. Again, thank you for your participation.